to another edition of Too Good for Drugs. I hope you all continue to stay safe and healthy during this time. And fortunately, this is our last Too Good for Drugs lesson for the year. So hopefully you all enjoyed it and have learned a lot. Now, for our last lesson today, we're going to talk about inhalants and street drugs and prescription and over-the-counter drugs. Now, before we talk about that, we're going to talk about risk-taking. Now, risk-taking is something that has a possible outcome of causing harm or a possible consequence. Now, with that being said, there's two different types of risk. There's a healthy risk and unhealthy risk. Now, a healthy risk is something that can make you a better person, will continue on trying new experiences, and it has the possible incomes of you might be afraid to do it, but if you do it, then it will make you a better person. Now, with the unhealthy risk, it's something that can cause possible harm to you and can get you in trouble. Now, we're going to go over two formulas of a healthy and unhealthy risk. Now, for the first formula of a healthy risk is something that equals safe plus legal plus supports goal achievement and helps you learn something new. Now, for unhealthy risk, the formula for that is something that is unsafe plus illegal plus hinders goal achievement and may cause unwanted consequences. Now, let's keep these two formulas in mind, and I'm going to read you all two scenarios. And with these two scenarios, I want you to figure out if this person is taking a healthy risk or an unhealthy risk. All right. Now, for the first scenario, we have Shayla. Now, Shayla noticed signs posted around school for an upcoming talent show. She wanted to audition and perform the modern dance routine, but she was afraid that she wouldn't make the cut. She worried that if she auditioned and wasn't selected, she would feel both rejection and embarrassment. Now, let's consider the healthy and unhealthy risk. Now, the healthy risk is that she is going to try something new, and she might make the show, and she builds confidence in herself for trying something new. Now, the unhealthy risk is where she might not make the cut, and her friends might figure out about it. But overall, that risk is healthy because the positive outweigh the negative. Now, let's find out what happens with Shayla and the talent show. Now, Shayla's friends and family encourage her to audition. Because of the positive encouragement, she considered her options and decided to take a healthy risk and go for it. Shayla performed a flawless routine for the judges, and she landed the opening spot in the talent show. After the audition, Shayla reflected on her decision to take the healthy risk, and it worked out. Now, let's figure out what type of risk Dylan is taking. Now, Dylan was a new kid in middle school and was eager to make friends. Dylan met Chris and Jared in band class. Chris and Jared knew a lot about music, and Dylan's passion was playing the trumpet. One day at lunch, Chris and Jared said that after school, they were going to hang out with some older teens that Dylan didn't know and smoke marijuana. They claimed it was a harmless way to get high because everybody does it. They pressured Dylan to join them. Now, we all know that in the previous lesson, smoking marijuana is an unhealthy choice. So it's obviously that is an unhealthy. Applying the formula for a healthy risk, the answer is obviously unhealthy because it's unsafe, it's illegal, and can cause harm to your body and unwanted consequences. So let's figure out if Dylan took that risk or not. Now, before agreeing to join his new friends, Dylan stopped to think. He considered his options and the positive and negative consequences of taking that risk to smoke marijuana. He knew that marijuana was illegal, and so hanging out with people who use it could put him in an unsafe situation with negative consequences. Dylan also knew that the harmful effects of smoking marijuana and didn't want anything to interfere with his passion of playing the trumpet, and his goal was to hit every note in the next recital. So after making his decision, Dylan stood straight up, looked Chris and Jared in the eye, and assertively told them he was not interested in smoking marijuana. Confident in his decision, he picked up his trumpet and left the cafeteria to continue practicing for his next upcoming recital. Now, Dylan made the right choice. And next time you consider taking a risk, remember the formulas. Is the risk going to leave me safe, healthy, happy, and more confident? Or is the risk going to leave me unsafe, harm my health, and get me in trouble at school or at home, or leave me feeling unhappy. Now, what kind of risk are you considering? I want you at home to think of 2 healthy risks you want to take. It can be anything. And take those risks, and with those risks, I want you to figure out if this risk is going to leave me safe, happy, and healthy. So it can be anything. Trying out for the basketball team, running a mount, anything that is a healthy risk and is going to leave you safe, healthy, and happy. All right. Now, we distinguish the difference between a healthy risk and an unhealthy risk. And we talked about using marijuana as a negative consequence. Now, there's other drugs that cause unhealthy risk. And the first drug we'll talk about is inhalants. Now, inhalants are chemicals that are inhaled for the purpose of getting high. Huffing is the nickname for the intentional inhaling of the chemicals. Now, we also have street drugs. Now, street drugs are drugs typically sold in the streets. And those drugs are cocaine, meth, and heroin. And they're not made in licensed laboratories. And they're not sold in pharmacies or prescribed by doctors. And they are made illegally and typically sold on the streets. Now, you also have prescription and over-the-counter medication. Now, prescription drugs, those are medicines that is prescribed by a doctor. And when a doctor prescribes medication, they consider 3 factors: age, weight, and reason for taking that medication. Now, with over-the-counter medication, there's medication where you can, doesn't have to be prescribed by a doctor. You can just get it at your local stores over the counter. Now, abusing both of these drugs can have serious side effects, and some of these prescribed medication and over-the-counter drugs have side effects of the same as illegal street drugs. Now, we're going to go over some of the short-term effects of prescription over-the-counter drugs and the short-term effects of illegal street drugs. Now, first we're going to talk about prescription and over-the-counter pain relievers. Now, some of the side effects with those are a high feeling, suppression of pain, decreased respiratory rate, clouded mental functioning, nausea, and vomiting. Now, for prescription stimulants, we have anxiety, high energy level, sweating, irritability, loss of appetite, increased body temperature, and dry mouth. Now, the last prescription over-the-counter medication we'll talk about is dextromethorphan, also short for DXM. And its side effects would be nausea and vomiting, dizziness, sweating, blank stare, confusion, blurred vision, loss of consciousness, and rapid heartbeat. Now, for the street drugs, some of these side effects are similar to the prescription over-the-counter drugs, such as anxiety, high energy level, sweating, irritability, loss of appetite, increased body temperature, and panic. And that street drug is cocaine. Now, for heroin, there is a high feeling, suppression of pain, decreased respiratory rate, clouded mental functioning, nausea, and vomiting. And last but not least, meth, which is anxiety, high energy level, sweating, irritability, loss of appetite, confusion, and dry mouth. Now today, we're going to do a little activity where you get to be the doctor in a hospital in an emergency room. And you have 3 patients, each with a number of symptoms resulting from the abuse of prescription and over-the-counter drugs. And you all have to figure out which prescription and or over-the-counter drug caused this patient's symptoms. All right? So the first patient we have is Rachel. Now Rachel's mother, according to Rachel's mother, Rachel was having trouble studying for a test in school. A friend of hers offered her some pills prescribed to him from his attention deficit disorder, which is a type of hyperactivity disorder. He told her that the pills would help her concentrate. Now, her mother brought her to the ER because Rachel could not sit still and haven't been able to eat or sleep. Now, here is the following symptoms on Rachel's chart: sweating, high energy level, anxiety, irritability, loss of appetite, And what type of prescription or over-the-counter drug did Rachel take? Now, if you guess prescription stimulant, you're right. She took a prescription stimulant. Prescription stimulants are prescribed to treat patients with hyperactivity disorders. These drugs are designed to create chemical imbalance in the brain, and correcting imbalance help those with hyperactivity disorder to focus. People without hyperactivity disorders who abuse these medications will experience symptoms of hyperactivity. So in other words, Rachel was less able to concentrate than before she took the test. Now, when it's misused, prescription drugs produce the side effects that are similar to which illegal street drug? And if you guess cocaine and meth, you're right. Both of these street drugs are stimulants. And Rachel was surprised to learn that prescription drugs can have similar chemical structures as illegal street drugs. Next, we have patient number 2, which is Marcus. According to Marcus' coach, Marcus had a headache at football practice. His teammate Anthony offered him a couple of prescription pain pills that his doctor prescribed when he had knee surgery. Anthony said the pills really worked. Marcus took a couple of Anthony's pills. His coach brought him to the ER because Marcus felt disconnected, had clouded thinking, and slow breathing, and nausea and vomiting. Now, what type of prescription or over-the-counter drug did Marcus take? And if you guess prescription pain reliever, you're right. Now, remember, the safe dosage of medication is based off many factors, including a patient's weight, age, and reason for taking that medication. And prescription pain relievers are a powerful opioid narcotic that works to induce sleep and block pain messages in the brain. Now, which prescription drug produces similar side effects of what illegal street drug if it's misused? And if you guessed heroin, you are right. Now, heroin is a legal narcotic. In fact, heroin is the most powerful and addictive narcotic, and the most powerful addictive of all the opioids. And like Rachel, Marcus was surprised to learn misuse of prescription pain relievers can produce dangerous side effects, similar to illegal street drugs. Now, last we have patient number 3, which is Chris. Now, Chris was hanging out with some friends. It was a rainy day, and without much to do, his friends dared him to chug a bottle of cough syrup to find out what happens. Chris gave in to the peer pressure and drank a bottle of cough syrup. Shortly after, his friends called 911. Chris was brought to ER because he was unconscious, and his friends said that he had a blank stare before he passed out. Eventually, he began throwing up before he passed out. They thought that he was just sleeping, but they couldn't wake him up. Now, what type of prescription or over-the-counter drug did Chris abuse? And the answer to that is dextromethorphan, also short for DXM. Now, DXM is found in prescription cold, cough, and congestion medication. And those that can purchase, you can purchase them over the counter. Now, Chris consumed a lot more than recommended dosage. Now, let's look back to our earlier lessons of alcohol, marijuana, and tobacco. Now, the misuse of the abuse of prescription or over-the-counter medication, DXM, produces side effects that are similar to which of these drugs? And the answer to that is alcohol. Now, today, we've learned that prescription drugs are safe and effective only when taken for a specific illness or symptoms as prescribed by a doctor and take it as directed. Over-the-counter medication carries the same warning. Take them as directed. And medication that is safe and effective for one person is not necessarily safe and effective for another person. So that concludes our lesson, our last lesson for Too Good for Drugs. I hope everybody has a safe summer. I hope you learned a lot. I hope that this was informative for you all, and I hope to see you all soon. And one more thing, we have a little survey for you all to take. The survey is about 4 questions long, and if you take this survey, you will get an award, all right? So if you can go to www.surveymonkey.com/r/TGFD video survey. And I'll say it again, it's www.survey.com/r/TGFD video survey. Thank you.